Hi, welcome to LiverGuru. I am Dr. Gursagar Singh Sahota, working as liver transplant and hepatopancreatobiliary surgeon in Bansal Hospital Bhopal. Today in this video we will talk about liver cirrhosis and the common queries about liver cirrhosis. We will cover the topics like what is cirrhosis, liver cirrhosis, what are its causes, what are the symptoms of liver cirrhosis, and what are the possible treatments we have, and how can we prevent the disease. So we will discuss on these topics of liver cirrhosis. Before we start, I'll like you to subscribe to our channel of LiverGuru and stay tuned with us. So talking about liver cirrhosis, let's see what is liver cirrhosis. So due to multiple infections or toxins or any disease of the liver, the normal healthy liver tissue is replaced by scar tissue, and that is a permanent change. So this stage of scarring is known as liver cirrhosis, which is a late stage or end stage liver disease. There are multiple causes for it. So because of this scarring in the liver tissue, the blood supply going into the veins from the liver gets hampered, and it leads to the complications of liver cirrhosis, which we will discuss in detail. So as we know, like liver cirrhosis is a permanent end stage liver disease. So what are the causes for liver cirrhosis? So this is a quite common thing. Now liver cirrhosis is increasing nowadays, and the causes for it are mainly, first of all we will talk about the common causes. This most common cause is alcohol abuse. The alcohol abuse, like people who drink alcohol at a very high amount on regular basis, it leads to permanent destruction of the liver and leads to liver cirrhosis. And the second most common cause is viral infections like hepatitis B and C infections, or in some countries even hepatitis D is there. So these infections can lead to liver cirrhosis with time if these are not treated early. The next most common cause for liver cirrhosis, which is on a rise these days, is fatty liver or NASH. This is non-alcoholic steatohepatitis or fatty liver disease. It's related to our lifestyle. Our lifestyle has become sedentary and we are dependent on processed foods, and this leads to more of the fatty liver and deposition of fats in the liver, which slowly leads to scarring of the liver and end-stage liver disease. There are some other less common causes of cirrhosis also, like inherited diseases, autoimmune diseases, or metabolic diseases. These are not very common, but yes, there are patients who come with such diagnosis and they have liver cirrhosis. So what are the symptoms of the liver cirrhosis, like how patients present, like what problems they have? So the symptoms of liver cirrhosis depends on the stage of liver disease. In the early stages, when the liver cirrhosis is developing, the patients may not be having any major symptoms. And the problem with the liver is the symptoms are very subtle. Usually in the early stages, patients ignore their symptoms, which are very mild, and the disease tends to progress. So in the early stages, usually patients have loss of appetite, they will have weakness or feel tired, they will feel low on energy. So these are the symptoms which tell that there is something going on with the liver. But as the symptoms progress, as the disease also progresses, the liver cirrhosis progresses to next stage, the symptoms of liver end-stage liver disease start developing. So these are the signs of liver cell failure. The patients may be developing jaundice, which is a very common symptom with liver cirrhosis. Jaundice presents as yellowness in the eyes or in the skin, or patients may complain of yellowness in the urine. So this is a jaundice is a symptom of liver cirrhosis. It's not a disease. Jaundice is a symptom which tells that the liver is getting affected because of some pathology. So other most common symptom with liver cirrhosis is gastrointestinal hemorrhage. Patients can have hematemesis, that is bleeding in the vomiting. They may have vomiting which has blood, or they may lose blood in the motions, in the stools, which present as black colored stools. Patients may require blood transfusions for that, and these hemorrhages can be life threatening. Other common symptoms are patients may have the fluid accumulation in the abdomen, in the belly. So patients have ascites. This is the fluid gets accumulated in the body, in abdomen, in the feet. These are the symptoms which tell that liver is failing. So apart from these symptoms, when the liver cirrhosis progresses further, then the symptoms become generalized to other abdominal organs or other body organs, and then liver may start affecting the other organs as well, like kidneys, brains, and even lungs. So patients may have problems with the urine, they have low urine output, or kidneys might be getting affected, and patients may be having a state of confusion if the brain is getting involved, which is known as hepatic encephalopathy, where the liver is not removing the toxins from the blood anymore, and because of the accumulation of toxins the brain is getting affected, which leads to hepatic encephalopathy. Patients may be feeling sleepiness in the daytime, and they may have difficulty in getting a good sleep at night time. And as a stage of encephalopathy progresses, patients may go into stage of confusion, or they may be totally delirious and they may not be responding to even commands as the disease progresses. If the lungs are affected, patients may have accumulation of fluid in the lungs, which leads to respiratory problems. Patient may have breathing problems. These all things occur when in the very later stages, when the disease of liver cirrhosis has become generalized and it leads to multi-organ involvement. So as we know the causes and symptoms of cirrhosis, now how to diagnose it, because diagnosing a liver problem is a major task. The diagnosis of liver cirrhosis depends on your symptoms and signs, and how your doctor goes ahead with your tests. So liver cirrhosis can be diagnosed by blood tests and with the imaging. With the blood test, the liver function test and hemogram, platelet count, and the liver synthetic functions, these are assessed. So in this way the clinician will get an idea the how much liver is getting affected. Then it gets confirmed by imaging like ultrasound abdomen or CT scan or MRI, depending on the situation, and then clinician can tell, a doctor can tell whether the liver is in early stage of cirrhosis or it is advanced. Also the advanced stage cirrhosis is also diagnosed by the other organ involvement, as we have discussed in the symptoms. So this can also directly tell about the diagnosis. Once the diagnosis is made, we have to think about the possible treatments of cirrhosis. Now if we ask about the treatments, it also depends on the stage of the disease. One thing we have to keep in mind, that liver cirrhosis is a permanent thing and it has to stay for life. We have to first know what is the cause of cirrhosis, and we have to rule out that inciting factor. If the cause is infections, we have to treat the hepatitis infections. If the cause is alcohol intake, we have to stop that abuse immediately. In the early stages of cirrhosis, we have to do supportive treatment, that the patient needs to be just have observation, and we have to see how much the damage has been done. So here the thing is that after the patient is diagnosed, we have to keep him on follow-up, so that we have to detect the life-threatening symptoms if they come. We have to detect them early and we have to treat them. In the early stages of liver cirrhosis, observation and supportive treatment will give a good quality of life to the patient. In some scenarios, despite the observation and supportive treatment, the disease progresses and it goes to the next stage of liver disease, and or end stage liver disease or liver cirrhosis. So when the liver cirrhosis has reached its end stage, one thing we have to keep in mind, in this stage there is no way we can revert it, and the only treatment which is going to cure the disease of liver cirrhosis is liver transplant. So before going for liver transplant, we have to stabilize the patient. We have to control all the complications, like the complications on the brain, on the kidneys or on the lungs. We have to control those complications with medications or any procedure which are needed. So after stabilization, patients with end-stage liver disease who have developed complications, they need liver transplant. So what is liver transplant? Liver transplant is a procedure where the patient's diseased liver or cirrhotic liver is removed from the body and it is replaced with a new liver. So new liver can come from two sources, like it can come from a cadaver or a brain dead donor, where the patient has died, his brain is no longer working but other organs are working. So in that scenario, the liver can be taken from that patient after a consent from his family, and that can be transplanted to the patient. Other source of liver can be a living donor. Patient's relatives can donate a part of their liver, and liver has a good property of regeneration. It's a very good organ that it's got a regenerative potential, and it grows on its own. So when a part of liver is taken, the donor's liver also regenerates, and patient who gets the liver also regenerates. So in this way, with these two kind of sources of liver, the liver transplant can be done, and it's a successful procedure. The success of liver transplant procedure is more than 95%. As the liver cirrhosis affects the quality of life, it affects the daily activities. So after a liver transplant procedure, as the time passes, patients experience a very good improvement in their quality of life, and the results are very satisfactory. So now the question comes, how we can prevent liver cirrhosis, how this disease can be prevented. As I told you, it all depends on our lifestyle choices and what are the problems which leading to cirrhosis. In lifestyle choices, we have to see that we not overdo on our alcohol intake, we not overdo on the processed foods, because processed foods lead to non-alcoholic fatty liver disease or NASH. As we know, NASH is on rise. We have to control the diabetes, we have to control the hypertension, and we have to control the hypercholesterolemia, and that means we have to control our lipid intake. Our normal diet nowadays also consists of a lot of salts. Our all packed foods or processed foods or junk foods, they have a lot of salts or sugars in them. So we have to avoid taking lots of sugars or lots of salts. These also lead to problems with the liver function and lead to liver cirrhosis. So we have to take a low salt diet, and we have to take a balanced diet. That means our home cooked food should be more in the quantity and should a high fiber diet in our routine daily intake. Apart from this, we have to maintain our healthy lifestyle. That means we have to routinely check our weight and maintain it within normal limits. Patients should not be obese, and also apart from that, we have to exercise regularly, because exercising leads to increasing metabolism and removing the toxins from the body, so that helps in improving liver health. Apart from that, we have to practice healthy liver practices. Now what are these? We don't have to overdo with the drugs or any medications we are taking, especially painkillers, because painkillers or anti-fever medications, antipyretics, they also affect the liver. So those has to be taken in only when required. Also, patients have to, who are having hepatitis B or C infections, they have to get the proper treatment, and they have to clear the virus from the body, because if the virus stays in body for a long time, then it leads to liver cirrhosis. Also, the people should get vaccinated for hepatitis B. We don't have the vaccine for hepatitis C yet, but hepatitis B vaccine is freely available, and everyone should get it so that hepatitis B can be prevented. So that was our video about liver cirrhosis. In brief, we have discussed about liver cirrhosis. So if you found the video informative, please like the video and don't forget to share with your friends. Also subscribe to our LiverGuru channel for regular updates. If you want to reach out to us on social media, you can do it on Instagram and Facebook at LiverGuru, or on Twitter at liver_guru. Thank you for watching. Have a great day.